is a great injustice that's happening in our country, and in LA County included. Black babies die before their first birthday at 2 to 3 times the rate of babies of any other race. And Black women are dying from pregnancy complications between 4 to 6 times women of any other race. And the only common factor that we have is the fact that we're Black. And that's something that's at crisis proportions in the county and in the United States.
The rate is, we measure it per 1,000 live births, and the rate for African American women is close to 9. For the most recent year we have 8.8 per 1,000 is the rate for 2017. And the rate for example, white women in the county and Asian women is just a little bit over 2 deaths per 1,000.
Black women who have master's degrees still have worse birth outcomes than white women who have not yet earned a high school diploma. Black women who do not smoke worse birth outcomes than white women who do smoke. So it kind of transcends socioeconomic factors, and the root cause is the exposure of the stress of racism for our bodies, that it harms us and makes us even more vulnerable in childbirth, and that of our babies as well. It's what the community is doing for the African American Infant and Maternal Mortality Initiative, which we call AIM here in the county. It really is this partnership between First 5LA and DPH. DPH really sounded the cry when it determined that this was an issue that they want to address in the county with the launch of its Center for Health Equity Action Plan, which really focused in on infant mortality. And then through community organizing efforts, the issue of maternal mortality, African American maternal mortality, really came to the forefront as being just as critical for us to connect with and to address.
So we look at, there's 2 different mortalities that we're looking at now. We're looking at infant mortality and we look at maternal mortality. So infant mortality, which is the traditional way of looking at this word, according to the California Department of Public Health, that 52% of Black women in the state of California are going to have a preterm birth, which means babies who were born preterm, before 37 weeks, low birth weight, less than 5 pounds and 5 ounces.
Both my children came 3 months early. I had done all the right things, so I thought, ate right, went to prenatal care, down folic acid like it was going out of style, and yet they came 27 weeks, 5 days to the day, both of them. But one of the things that I learned, that there wasn't anything that I did that contributed to that. The only factor, and I didn't learn this until later, was the fact that I am an African American woman living in the United States, and that my story isn't as special as I thought it was, that there are quite a few Black women who've experienced this crisis, except many have not gone home with their children.
We've tried a lot of fixes up till now. There was a period of time when a lot of emphasis was put on making sure Black women had insurance coverage, expanding Medicaid for pregnant women so more women were covered, thinking that it was access to prenatal care that made the difference. We've tried offering case management programs to help Black women find their way into prenatal care and other kinds of resources. And while those efforts improve outcomes overall, they have not closed the gap.
It really is a confluence of factors. It's the coming together of multiple challenges. One primary challenge being the ongoing, repetitive, unceasing nature of racism in our current society, but also across generations in terms of what African Americans have faced, what we have faced across the years and across the decades. That stress of racism, we always say, oh, stress kills, in terms what we always think of in terms of heart attacks and strokes. Well, it has a similar effect on our bodies. You know, it puts us in a flight or fight mechanism that's constant. And that stress load on our bodies is harmful to us, and it manifests oftentimes in childbirth, both for baby and for mom.
We think we need to intervene at 3 levels. Upstream, we need to be thinking about what can we, as a health department, as a community, with our partners, do to reduce the stress in Black women's lives. And we ask everybody in the county, what can we do to reduce discrimination and the stressful effects of discrimination for Black women? That's number 1. Number 2, given that we are not in a position to get rid of all those stressful experiences, what can we do to make sure that stress in the environment doesn't turn into stress in the body. So that's really a matter of offering social support that helps women cope, helps women take a deep breath, if you will, and reduce the impact of stress on their health. Third, because we probably can't do that adequately for everybody either, the question is, what can we do through the healthcare system so that women whose health has been compromised by stress get the best possible medical care to assure that it doesn't turn into a catastrophe for the mother and the infant. And that's really where the healthcare system is the most critically important.
I feel the greatest reward between the partnering of community and a Department of Public Health are those aha moments where you see input from community members result in a change or a shift in the system. A recent example was the steering committee, along with the community action teams in South LA and Antelope Valley, which are led by the Department of Health Services, helped write a proposal to the state of California to receive funding to support this work. And so this was truly a collaborative effort. There's still work to be done for communities to be aware that this is actually a thing, and that the thing is not a result of Black women not taking care of themselves, not eating right, not going to prenatal appointments. That is not that, and that there is hope in this work. There's solutions, there are interventions, there are things that can be done. But in terms of looking further out than that, we want to see healthy and joyous births for every family, especially African American families. We want to be able to have our babies and we live, and they do too.